How y'all doing? Everybody, how y'all doing? Nice to see you. Welcome to Washington. Let me start by quoting my dad, a phrase my dad used to always use. Whenever you'd say something, someone would say, well, this is what I value, this is what I support. My dad would go like this. He'd say, look, don't tell me what you value. Show me your budget, and I will tell you what you value. Seriously. I had the great privilege, like many of you, of having my mom and dad live with me in their last years. My dad would only move in with my mom when hospice was necessary. And it turned out, God love him, he beat the odds, which he always did, and instead of being 6 weeks, it was 5 months. And I had the great pleasure, like all of you, and like every child who wants to take care of his parents, of being able to kiss them good morning every morning and kiss them good night when I came home. The generic point is my mom drove until the very end. And so she used to go up to what used to be called Happy Harry's. It's a chain of drugstores in Delaware, now it's Walgreens. And so my sister suspected that Mom wasn't, and do you know anybody who's a senior that doesn't have, especially an octogenarian over 85, who doesn't have 6, 7, 8 prescriptions they take? And for a child, it's one of the hardest things to do is literally get it right and make sure you have it, you know. And so my sister Valerie, smarter than I am, she said, Joey, I don't think Mom's getting all her prescriptions. So I followed her up one day. This is before I got elected and they didn't have the Secret Service take me. I followed her up. It's only about 1.5 miles, and I went to Happy Harry's, and there's a blood pressure machine. There's aisles and a blood pressure machine at the end. So I sort of hid behind the blood pressure machine because people lined up to get their prescriptions at the window, you know, the pickup window. And there's a beautiful lady, beautiful personality who's the druggist there. And what happened is my mom went up and she got like a deck of cards, chips handed to her, all these prescriptions. And she very politely said, oh, I don't need this one, honey. I don't need this one. My mother was ashamed to tell me. I could easily afford it. My sister could easily afford it. My brothers could easily afford it. And we all did. But Mom was too proud. Too proud to say, I'm short getting this prescription. That's why this country's so great. Because people with pride and dignity like my mother. That's what made this country. And the idea at the end of their lives, we're going to do this, is beyond my comprehension. We need your help. You all.
Sequenzia Titus with the American Society of Consultant Pharmacists. Again, I want to thank you guys for all the work you do. It's incredible the amount of effort that you guys put into the seniors, and we really appreciate it. So I just wanted to bring up a point. The administration and Congress has widely regarded electronic health records as something that can help the front end of the healthcare system as well as improve patient outcomes. Dollars were passed up in including electronic health records in nursing homes. And I wonder if the administration has any plans moving forward on including electronic health records in nursing homes. Our members would definitely greatly appreciate that.
Wow, that's a pretty technical one. I also co-chaired the HHS task force with Farzad over at HHS. I think the idea of legislating in this area right now would be highly challenging. We view health records as being sort of a necessary sort of part of enabling technology to get us where we want to go on quality and all kinds of other things. In principle, I don't see that being any different in nursing homes. Now, are they not eligible under the Medicaid share?
Apparently the funding doesn't exist for it right now, and there's talk in the Senate, some senators supporting adding funds for that.
I see.
But right now it's not.
Well, thanks for flagging that. That has not been on my radar scope. I appreciate it. I don't have any direct answer to you. We don't have a specific proposal. Thank you very much for making me aware of it.
Sure, we're happy to work with you to help that make that happen.
I don't have an answer. I just wanted to share that I recently met with Farzad Mashashari, the head of ONC, and was asking similar questions, not just about nursing homes, but about community services. There are a couple of policy issues in there that I think are important to watch. That as we show the cost effectiveness of alternative forms of care, community services, it's important that we integrate healthcare systems. So I just want to say I'm quite willing to partner with pharmacists and be allies about the continued sort of value. But also from a consumer point of view, that as we make electronic health records more available to consumers, that we also have consumers at the table and their family members, because we need both infrastructure that helps knit these together, but then information that consumers can use as they interface with their own providers. And so I think there are a couple different things. I just wanted you to know that we had a good meeting. As far as I was very supportive. I mean, I understand finances could be different, but I want to be able to work with you all as well.
Great.
And at least be able to spot what the policy issues are we can talk about.
Fantastic, thank you.
You all have impact in your communities. You're parts of large organizations and some not so large. But please go out. As they say, as I say, speak plainly. Speak plainly to the people you know. You influence people. They respect you. It's not just the organization. You wouldn't be here if you weren't leaders. Some things are worth fighting for, folks. And this is worth fighting for. God love you all. Thank you very, very much. May God protect our troops. Thank you.